You know, as future nurses, we're taught to treat the disease, right? The broken bone, the infection, but what about the person attached to it? What happened when a patient behavior, their stress, their fear, is the real obstacle to their recovery?
That is exactly what we are going to explore today. We are breaking down the Dorothy Johnson's behavioral system model, a theory which helps us see patients not as a medical case, but also as a finely tuned system of behaviors.
Dorothy Johnson was a visionary nursing theorist from the mid-20th century. She published her model in 1968 at a time when nursing was evolving from a task-oriented role to a more professional, holistic practice. She believed that nursing's central mission was to help patients maintain a state of behavioral equilibrium.
So, what is a behavioral system? Think of it like a control panel for a person's life. Johnson proposed that every person is a system composed of 7 interconnected subsystems. When a patient gets sick or experiences stress, this subsystem can go out of balance.
The 7 subsystems are affiliative, our need for social connection; dependency, our need for help and care; ingestive, our relationship with food and fluids; eliminative, our body's waste processes; sexual, our sense of identity and reproduction; achievement, our drive to succeed and master things; aggressive or protective, our instinct for self-defense. Johnson's model gives us a roadmap. It helps us nurses predict how a patient will react to illness and provides a clear framework for interventions aimed at restoring balance in their behavioral system.
Let's put this into practice with a scenario right here at school. Imagine a student named Sarah who has been in the school clinic for a few days after a minor sport injury. She's not eating the food provided, she's isolating herself from her friends, and she's becoming very irritable with the nurses.
Let's use Johnson's model to figure out what is going on and what we can do.
Sarah isn't eating. It's because of pain, anxiety, or something else?
As nurses, we would first assess the situation. We can ask her, Sarah, I've noticed you haven't touched your lunch. Are you in pain or is something else making you feel this way? This helps us identify the cause of the imbalance and intervene accordingly, perhaps by offering different food or managing her pain.
She is isolating herself. Her need for social connection is disrupted.
We could facilitate a connection. Maybe we'll call one of her close friends to visit or suggest a group activity in the clinic's common area. Our goal is to gently guide her back towards social interaction.
Sarah is being irritable, which is her way of protecting herself from a stressful situation.
We must not take her irritability personally. Instead, we can acknowledge her feelings by saying, "It seems like you are feeling frustrated right now. We are here to help. Is there anything you'd like to talk about?" This approach validates her feelings and opens a line of communication.
So what makes this model so valuable? It is holistic. It pushes us to look beyond a patient's physical symptoms and consider their entire being. It also provides a clear framework for nurses to assess and intervene, especially in situations where a patient's behavior is a primary concern.
Of course, no cure is perfect. One limitation is that the model can be a bit complex and doesn't always provide a specific medical guidance or technical procedure. For example, it won't tell you the exact dosage of medication, but it will help you understand the patient's behavioral response to it.
are not simply victors of illness.
The Dorothy Johnson model teaches us to be the guardian of behavioral equilibrium.
Ensuring that patient internal systems are aligned for healing.